Now the state is ordering hospitals to suspend visitation and limit elective surgeries.
We have team coverage of the coronavirus pandemic. Keith Daniels begins us with more on the pressure being felt at local hospitals. Keith?
Well, Kai, the governor was direct and to the point. It's a critical situation, and tonight he's making a move that he believes could save lives. As the coronavirus continues to spike out of control across the country and in Maryland, Governor Larry Hogan fights back with sweeping new orders, including a crackdown on hospital capacity.
I've always been a straight shooter, so let me give it to you straight.
Hogan and state health officials are concerned, saying hospitals are reaching capacity, filling up. As a way to save bed space, Hogan is telling hospitals and patients to avoid elective procedures, including surgeries, if patients are likely to need ventilation, intensive care, or skilled nursing care.
We do not want Marylanders to put off life-saving treatments or surgeries. But our highest priority right now is preserving capacity at our hospitals.
Dr. Ted Delbridge.
It is appropriate. It is measured.
Executive Director at the Institute of Emergency Medical Services Systems, keeps watch over emergency room capacities and bed availability at hospitals across Maryland. As of tonight, he says there are 600 acute care beds available throughout Maryland, which is a fair amount, he says, and 200 intensive care unit beds, which he says is typical. That's 800 total hospital beds available throughout Maryland.
There is plenty of capacity in the system in the moment, but we want to make sure that we're totally prepared for future state.
Delbert says Maryland has done plenty to prepare for this latest surge, including adding a number of surge beds for COVID-19 patients, like what's found at the Baltimore Convention Center, a field hospital showcased this spring. Well, state health officials say they're also issuing an emergency order that will allow hospitals to transfer patients from facilities that are either full or near capacity to hospitals that can provide them care.
Changing the way police investigate crime. Jeff Abel is live with an explanation. Jeff?
We are learning tonight that crime scene technicians, depending on the circumstances, will not be responding to every crime every time.
There was a brick maybe about this size that had been thrown with enough force through the window that it actually wound up almost in the hallway over here.
When thieves crashed through his kitchen window, it cost Gabriel Gallico his most precious possession. 2-year-old Rosie, his beloved Boston Terrier, was gone. By the time Gallico could race home from work, officers were already on the scene.
I was able to go inside, but they told me not to touch anything.
Officers had called technicians to come search the scene for evidence. But with the crime scene still fresh, crime scene technicians never arrived. There would be no search for forensic evidence.
For somebody to put a brick through somebody's window, enter the home, burglarize the home, steal a dog, I mean, the chances of them having fingerprints on file, prior criminal record or something are very high. So, why not at least eliminate that aspect of it?
Police admit today that for the safety of officers, the pandemic has caused them to tighten their protocols when it comes to crime scene investigations. In some cases, technicians may not be entering buildings, they say, unless responding officers find that there's evidence of prints they can recover.
To some degree, I understand that. You're putting your life at risk. But, on the other hand, I work for a children's hospital. I've been on site at work every single day since the beginning of March.
As Gallico continues to search for his beloved pet, he wonders if evidence went uncollected that could have brought Rosie home.
I know that there's a million problems in Baltimore right now, and Rosie is the least of them. She's my biggest problem. But I think that it would make everybody feel pretty good if she comes home, and you know what? It would certainly make me feel good.
Well, police tell us tonight that police officers are indeed trained to find and recover prints when technicians do not arrive.
Officials work to enforce those new restrictions. One county says its staff is facing unprecedented harassment.
It's hostility that has left some of those workers fearful for their safety. Fox 45's Dan Lamparello continues our team coverage with the precautions now being taken.
Well, health inspectors in Anne Arundel County say over the past few weeks, they've experienced on multiple occasions business owners who are not complying with some of those COVID-19 restrictions, harassing, even threatening those workers. It's showing that many people are at wit's end when it comes to this pandemic.
COVID-19 restrictions have not been easy to handle, nor has their enforcement.
I want to really be blunt about what's happening. It is a challenging environment for our enforcement staff to be out there.
Dr. Naleesh Kalyanaraman with the Anne Arundel County Health Department says his staff has been subject to unprecedented harassment throughout the pandemic.
We are seeing that our staff, and particularly our female staff, are being met with hostility at a level that we have never seen before.
The most recent incident happening last week when inspectors tried shutting down a restaurant in Glen Burnie for being over capacity. The department says inspectors were then verbally assaulted and even had to call the police for help.
I find it really troubling that people are taking their frustrations out on our staff.
It's frustrations we've seen flare up in the county before. Earlier this month, employees at a Cold Stone Creamery were beaten by two customers who refused to wear masks.
This prolonged stress is really taking a toll on people's emotions.
Tamar Mendelson is a professor at Johns Hopkins University and says the pandemic has put more people on edge and could explain why some are now lashing out.
Right now, people have a shorter fuse. They have, their nerves are frayed. They're less able to access sort of techniques for regulating emotions.
But whatever the reason, health officials are calling for more civility as they try to keep the public safe.
Frankly, it's not acceptable. They are doing their job. They're doing what we've asked them to do.
Now, the harassment has gotten so bad that the county health department there in Anne Arundel County says they've temporarily stopped doing high-risk enforcement at night. They're planning on meeting with the county police department this week to figure out the best steps forward to help protect those inspectors.
Hospitalizations are also rising as the numbers surge. In fact, the governor is imposing new restrictions aimed at slowing the spread.
And starting this Friday, the state will revert to some stage 2 restrictions, including new rules for restaurants and reduced capacity at stores. But what's the scientific data behind enacting capacity limits and curfews?
Fox 45's Alexa Ashwell questioned the state and joins us now live from downtown with more. Alexa.
Yes, Kai and Mary, here in Baltimore City, specifically right now we're in Fells Point. Not only is indoor dining capped at 25%, but now these restaurants must close by 11 p.m. Tonight I questioned a medical advisor about these decisions.
Dr. Cliff Mitchell is the director of the state's Environmental Health Bureau and is part of the group that provides COVID-19 related data to Governor Larry Hogan, helping shape his decisions on restrictions.
What is the scientific data behind that required closure time?
Sure. And the answer to that is it's a mixture of science and also a lot of observation and experience. So we've been looking very closely at our contact tracing data and also at complaint data coming in from local health departments, coming into the Maryland State Police and local law enforcement. And all of that has pointed to a couple of different factors as being significant in the spread. Number one, we know that people are going to social gatherings, meeting friends, family, and others in settings where there's a large group of people, and particularly when people are not socially distanced and not wearing face masks, particularly during dining and drinking.
Dr. Mitchell says the state is receiving more complaints in the evening, pointing to this when questioned about other businesses, including gyms.
If you can't enforce the facial masking requirements, the other thing to do is decrease density in the gym.
But why does the hour, the time of day, matter in that equation?
Well, again, the whole idea is if you are decreasing opportunities for people, part of this is compliance, part of this is being able to enforce. And while there may be no perfect answers to this, the overall thrust of these requirements and the governor's actions is to get people to shelter, to quarantine.
Now, I also asked the doctor about capacity limits inside businesses, specifically these small businesses that are already seeing less foot traffic than a big box store. He says it's about density within the facility and compliance. Kai Mary saying less people are social distancing and wearing a mask.
Lines to get a test are popping up in several places.
That's right. Mackenzie Frost joins us in the studio with what you need to know to find a COVID-19 test. Mackenzie?
Yeah, well, let me show you exactly what we saw today in Baltimore City. Take a look at this photo here. This was from the Baltimore Convention Center, and the lines was wrapped all around the building of this convention center throughout the morning. For some people, waiting for hours today was their only option to get a test.
I assume it's because of the holidays. It has to be, because this is just wild, and just with the spike.
Tried to make an appointment, and there weren't any until too late for us because we're supposed to go in a few days.
It's the cheaper route, and it's turning out to be the most convenient. It seems to be a lot of barriers for you to get tested.
So here's the deal. There are some testing locations that don't require an appointment and some do. The ones that don't require an appointment seem to be the locations that we're seeing with significant lines, like the Baltimore Convention Center. But in Baltimore, the Convention Center is just one place to go without an appointment. Testing is done Monday, Wednesday, and Friday from 8 until 2. But today we saw that stay open until 3 o'clock as more people were being tested. Now, we also are seeing the city updating other locations throughout the week. Take a look at this. Tomorrow at the Zeta Center, Friday, the Rehoboth Church of Divergence and the Druid Hill YMCA will all offer testing. Saturday, there will also be testing done at a Baptist church. Now, there are some other locations doing testing. I found it's best if you call early to make an appointment for those locations that do require an appointment. Let's take a look in Baltimore County, the health department's website showing a list of testing locations available to anyone. They recommend appointments, but you can just walk up and get a test. Here's a look at some of those options in the county. Dundalk Health Center, Lansdowne Health Center on Mondays, the Greens Apartment Information Center in Essex on some Wednesdays. Be sure to pay attention to the dates and locations because those are changing. On Tuesdays and Thursdays, the State Fairgrounds is also offering testing. And bottom line, what we're seeing, it's complicated. If you don't have a doctor's note and you don't have an appointment somewhere to get tested, it can be a little tricky, but it'll likely mean waiting in line if you don't have any of those. The state does have a website where you can put in your address and see the different testing locations near you. I'll put a link to that in this story along with these other options and the locations for the testing in our website.
Baltimore's coronavirus restrictions are already stricter than those announced by the governor today. Yet the city is spending millions of dollars on a new ad campaign to promote tourism in the city. Jeff Abel joins us right now live with that story. Jeff?
It is raising a lot of questions tonight. An ad campaign, which the city is spending $5 million to sell tourism in this city, is coming at a time when much of the city is shut down.
Throughout this city, small businesses are fighting for survival.
We're all tired. And it's a matter, I think, of how tired are you?
While many businesses struggle to find assistance to help keep them open,
everybody should definitely come to Baltimore.
We showed owner Claudia Tolles today the ad campaign the city is spending millions to produce.
As a business owner, those numbers, I hear them and they kind of are a gut punch.
All of these businesses are taking precautions.
The campaign aimed at promoting tourism in Baltimore is hitting the airwaves this week. The city is spending $5 million in funding from the Federal CARES Act to pay for it.
Funneling dollars into tourism promotion isn't going to do a lot of good if the city is still largely on lockdown.
Pete Sepp is president of the National Taxpayers Union and questions whether small businesses will see any return from the $5 million investment.
Taxpayers as well as tourism for the city of Baltimore would probably be far better off if these funds were directed to providing PPE for small businesses or providing property tax relief at the local level.
But Visit Baltimore, which promotes the city and produced the campaign, is defending the campaign, saying in a statement, the underlying message is whether you're feeling ready to venture out now or simply want to begin the planning process for a future experience. Visit Baltimore is here to inform, guide, and inspire.
Could it be spent in a different way? Sure. I'm not going to disagree with spending it on promoting Baltimore, but I think that there are opportunities to be more compelling.
Claudia Tolles isn't critical of attempts to promote the city, but believes multi-million-dollar campaigns like this one could be more effective. For now, the verdict is still out.
Am I holding my breath? No.
Well, earlier today, we also questioned the city's finance director about this expenditure. We are still waiting for his answer.